I can do it on your left this time. Some back street. Okay, James, where's Hugo? Hugo, why don't you come up? There. Okay, we got a couple of topics, and let's get going. We're starting off today's briefing with a call to action that I know Houstonians can support. I am joined by Cameron James, president of the Houston Restaurant Association, and then Chef Hugo Ortega, Backstreet. Thank you both for being here, and then Mayor Pro Tem Dave Martin. And we will be joined by two others virtually in a few minutes. COVID-19 has changed our city and disrupted our routines. Businesses across the state are suffering, and that includes the restaurant industry. According to the Texas Restaurant Association, the restaurant industry has a $70 billion impact in Texas, and the restaurant industry is the fourth largest employer in the Houston area with more than 300,000 employees. Today, I'm proud to announce that I have joined the Houston and Texas Restaurant Associations, and together we are urging everyone to support our local restaurants. I did it earlier today, and quite frankly, I'm still full. We want you to order takeout and delivery, but you don't have to eat it all at one time like I did today, which is why we are starting the Take Us to Your Table campaign starting next Thursday, April 23rd, 1 week from today. That's next Thursday, April 23rd. Take Us to Your Table campaign. While you may not be able to get a seat at your favorite restaurant right now, they can certainly have a seat at yours. And every Thursday, please consider ordering takeout or delivery as part of your weekend plans, and share your meals on social media with the hashtag #TakeUsToYourTable. And joining us virtually is Dr. Emily Williams Knight, President and CEO of the Texas Restaurant Association, and Linda Dashami, I think, with ExxonMobil to explain who they are assisting. Let's start first with Dr. Emily Williams Knight. Can't hear you, Emily. Emily, unmute your phone. Do we have her muted? Can we get it? Cameron, let me bring you up.
Thank you, Mayor Turner and Dr. Knight. I'm proud to be here today as President-elect of the Greater Houston chapter of the Texas Restaurant Association, and as a third-generation Houston restaurateur myself. I'm proud to stand here and represent over 12,000 restaurants and over 350,000 restaurant workers in the city of Houston. Restaurants have always been the go-to place for the most special times in our lives. Birthday celebrations, anniversaries, engagements, watching the games with our friends, watching the Astros win the World Series. Our doors have always been open to accommodate the most intimate experiences for all of us, as well as bringing families together for a meal each and every day. In a crisis, restaurants are always there, standing in support of victims and first responders. During Hurricane Harvey, it was restaurants who opened their kitchens to make sure responders, evacuees, and volunteers could have food to eat. We are regularly asked to contribute to the community as sponsors or food donors. And we are happy to do it because we care about our communities and we want to support them. Now we need the support of our communities more than ever. Our restaurants, local independents, large chains, small mom and pops, bars, your favorite restaurant down the street are all in jeopardy. The livelihoods of not only the owners, but of the waiters and the waitresses, chefs, line cooks, bartenders, dishwashers, hosts and hostesses, all the way to the food suppliers, farmers, ranchers, are all at risk. And we need every Houstonian support right now to get through this, or else your favorite restaurant won't be here when this pandemic is over. Order takeout and delivery. Get your meals and drinks from the restaurants of Houston. The safety of our customers, staff, and food delivery workers is of the utmost importance to all of us. That's why we are following all CDC guidelines on food preparation and delivery, as to ensure that we do our part to slow the spread of COVID-19. At this time, unfortunately, you can't come to our tables. So please, we're asking you, Houston, take us to your tables. Thank you.
Thanks, Cameron. Can we get Emily at this time? Is it working now? Emily, can you hear us? Still not there. All right, let's keep working on it. What about Linda Deschamps from ExxonMobil? Nope. Okay. All right. Let me just again, next on Thursdays, we're asking people to please order from whatever your favorite restaurants are, and support them. Chef, when you are here, Chef Ortega, why don't you come and encourage people to be supportive of the industry?
Well, like Mayor say, it's time to come together, and what a great opportunity for me to just be able to cook for all of you. And all this wonderful city they have given us so much. So on behalf of Tracy, H-Town Restaurant Group, and all the restaurants of this wonderful city, we invite you to support, and the hashtag is take us to your table. I would like to say at this moment, extend my gratitude and all of my family to Mayor Turner. It takes a quality of leader to be able to do what we have done so far with this pandemic. It will be probably not the last one, but I hope it's the last one. And this is the time for us to come together. Once again, on behalf of my family, this wonderful city, and of course, Mayor, thank you so much. We invite you to come, take me to my table. Thank you so much.
Thanks, Chef, and I certainly would love to connect these two that are, oh, technology, but it is what it is, and if y'all stay fit and stay right where you are, and hopefully we can make this connection happen real soon. Please support out there our restaurants. There are over 300,000 employees just in the Houston area alone, and they are counting on us to support them. And of course, ExxonMobil is being very generous. Wanted them to make their announcement. So if we can get a connection, we'll make it happen. Is it not? Still not? It is just not going to happen today. All right. Let me thank you all so very much. Thank you so very much. Now let me ask Dr. Purse if come forward, and Congresswoman, if you want to come at this point, if you all come stand as we segue to the second part. Today, the Houston Health Department is reporting 125 new cases of COVID-19 today, bringing the total case count in the city of Houston to 2,456. And the total number of deaths has increased to 29. That's an increase by 3. The 3 new deaths today include a Hispanic female in her 80s with underlying health conditions who passed away on April 1st, 2020. A black male in his 80s with underlying health conditions who passed away on March 31st. and a white male in his 60s with underlying health conditions who passed away on April 11th. That brings the total people who have died as a result of COVID-19 to 29, and again, we're reporting 125 new cases. We're going to be expecting more as the amount of testing continues to grow to take place within our city. Note that the earlier deaths were identified through matching information with death certificate data, the hospitals reporting them to us, and so we're trying to provide these counts to you in as early as possible. The more recent death was a death at home, and the city worked with the medical examiner's office to get the decedent tested at the Houston Health Department lab. At this point in time, let me call on Dr. Peirce to add to anything that I've already stated. Dr. Peirce.
Thank you, Mayor. And as you see, the numbers continue to fluctuate. The number of reported positive cases continues to fluctuate. So again, I call on our lab partners to try to be as consistent as possible in providing us with that information. And again, today we have a number of deaths. Each one of those is tragic, and we wish that they were prevented. But the only way we can prevent future deaths is for each of us to wear your mask, wash your hands frequently, social distance. And again, our partners in the hospitals have done a great job of learning how to manage their processes so that we remain under the capacity of the hospitals, which is important. And they are improving greatly in their reporting of information to us. And so as the mayor points out, that with the exception of the one case where we're working with the medical examiner, the timeliness of the death reports are getting much better, and that's going to help us get accurate information to make strategic decisions as we move forward. Thank you.
We're also joined today by Congresswoman Sheila Jackson Lee and some special guests from Hyundai Motor America. Hyundai Motor America, I'm pleased to say, selected Houston and the 18th Congressional District as the recipient of the Hyundai Hope on Wheels COVID-19 Drive-Through Test Grant. The grant is being gifted to the Houston Health Foundation, which is the city of Houston, which supports the work of the Houston Health Department. This donation consists of $100,000 and 10,000 COVID-19 testing kits valued at about $150,000. This will allow for the expansion of diagnostic testing in the greater Houston area to combat COVID-19. I certainly want to thank Hyundai and Congresswoman Sheila Jackson Lee for their continued support to the city of Houston, and we are honored to be the recipient of this gift, the $100,000 and the 10,000 test kits. We continue to recognize the need for expanded testing throughout Houston and Harris County, and this grant will allow us to work with a variety of community-based organizations to further that goal. It is imperative that we expand into neighborhoods, and I've given the Houston Health Department the directive to do exactly that. Also want to acknowledge United Memorial Medical Center, UMMC, Dr. Ferron and his entire team for also the testing that they have been doing on 2 locations on Tidwell, and then just recently setting up the testing site at Cullen Middle School, which started on Monday. And all of that is taking place within the city of Houston. And again, that was done in collaboration with Congresswoman Sheila Jackson Lee. And I want to give a special acknowledgement to her because she's been instrumental at each and every one of those sites. And again, without her collaboration support here, I don't think Hyundai would be making this particular gift to the city of Houston. So I certainly want to thank her and Hyundai. And let me just pause to acknowledge now Congresswoman Sheila Jackson Lee.
Mayor, thank you very much. As the mayor has indicated, testing. As we are standing here today, there are people in hospitals who are deadly sick with COVID-19. This morning, a constituent sent the story of 2 senior citizens who were doing well and went to a store, and one developed COVID-19 and died, and soon after, the other developed COVID-19 and died. It is likely that those individuals were not tested. And as we have seen individuals in hospitals, Mayor, they're not tested. So I want to turn to thank this mayor for his leadership and champion and collaborating on knowing that it is testing, testing, testing. Your work has not gone unnoticed. It is in the numbers. Houston's COVID-19 death rate is among the lowest of the major cities. And though we know that COVID-19 travels, it is contagious. Houston's name has been listed as a city to watch. We have a great watchman who is standing and working with us for testing, testing, testing. It is for that reason that we were able to begin testing at UMMC on March 19th and proceeded to go to the Smart Financial Center, West Tidwell, Forest Brook Middle School, Jacinto City, and Cullen Middle School. Most of them are operating today. We follow in the words of Dr. Peirce. The city's health authority has cautioned that while the numbers today seem favorable to slowing the spread, we must continue to be vigilant. They can change instantly. And the city and county are very aware of that, and I thank them for the stay-at-home order, for the social distancing, and the wearing of coverings. We know, however, that the state of Texas has not fared well in testing. 14,624 cases in the state of Texas and 318 deaths. But it matters to us that we continue to work. For that reason, I wanted to ensure that the relationship that we had established as a member of Congress in the 18th Congressional District with Hyundai in the fight against pediatric cancer, that Hyundai would take note of the great work that is being done in this community. And they did. They have given a very special gift to the Texas Children's Hospital, upwards of $200,000. And they are looking to be the company that reinforces public servants on the question of testing, testing, testing. I want to make sure that we're aware of many hospitals. The president and CEO of the St. Joseph's Hospital that is here in our community, Kim Bassett, is in the room, and she has indicated that she is a hospital that has COVID patients, and many of them may have not been tested. I'm very glad to see Sheriff Gonzalez here. He is working very hard to expand testing in the Harris County Jail and be one of those who participate in this program to be able to utilize these test kits. The mayor has already introduced the chief medical officer of UMMC, who has a passion for testing and serving the most vulnerable. And we know that that is the only way we can save lives. We are pleased to have Mr. Saeed Mohideen here, who is the CEO of that facility, and other doctors who are here. As the mayor said, we are so pleased to be able to receive this gift and to bring it to this community because it will allow expanded testing, but as well, it will follow the strategic plan of this city and my vision of going into neighborhoods. As we go into neighborhoods, we have found that people line up to be tested, and many others are crying out to be tested. We hope that this will be a very important part of that effort. And Mayor, we're hoping that as we begin to focus on the CARES Act 2, that we'll put more funding for no-charge testing, as we have put in CARES Act $5 million for Harris County and $2 million that can deal with criminal justice issues. So it is certainly my pleasure to be able to acknowledge Hyundai for the collaboration and the working relationship we've had. I want to thank Mr. Munez, who is the CEO of this company, and of course, his very important Vice President, Zafar Brooks, who we'll hear from in just a moment, and then we'll present the city with their big check. I thank you for the friendship and the ability to collaborate. As I said, there are people now, as we stand here today, that are in hospitals fighting for their life in Houston and Harris County. Many of those were not tested. We don't want that to be our future. We're sad that it is our past. We only want our future to be based on providing people with the life that they will have. May I, Mayor, acknowledge Mr. Brooks? Is he hooked up?
I'm going to say Mr. Brooks is probably standing by, just like the others today. We're going to say, we're going to call out his name, Mr. Zafar Brooks, Director of Corporate Social Responsibility and Head of Diversity and Inclusion for Hyundai Corporation. And were you able to hear him, he will be saying, Congresswoman, Mayor, these are 10,000 test kits being provided by Hyundai. And so, as they say on the Academy Awards, in his honor, we shall accept this award from Hyundai. And thank him.
As I do that, let me acknowledge Mr. Steve Williams, Dr. Purse for their leadership, and of course, a very, very able head of the Houston Health Foundation. Robin, are you in the room? No. We want to thank Robin, but this is to the Houston Health Foundation. Again, if I say it once, I say it again. Testing, testing, testing. We're saving lives. Thank you, Hyundai. Thank you, Zafar.
Okay, so at this point in time, we'll take any questions that you may have.
Open up the city's economy, what sector would you open first?
Well, we're working on that. I can't give you an answer to that right now. Quite frankly, we are focusing right now on making sure that people are staying at home, working safely, engaging in social distancing, wearing face coverings, because we are still in this storm. And I want people to be singularly focused on doing everything we can to keep themselves safe and to keep other people safe. We're developing the teams that are working on what the next steps will be. I know the president may be saying something later on today if he hasn't already said something. I think the governor is planning on saying something on tomorrow. But we are right now having those type of conversations. Ask me that question a little bit later on next week.
Certainly there's planning that is taking place. You just alluded to that. Could you give us some specifics of the conversations?
I'm not in a position right now to give you any specifics on that. What I can tell you, testing is critically important, making sure that we slow the progression of this virus so that it doesn't overwhelm our healthcare delivery system, making sure that we protect our vulnerable populations and people at risk. And those are individuals with heart disease, lung disease, diabetes, on dialysis, asthma, sickle cell anemia, our seniors, because all 29 of the people who have died with some underlying medical condition. That's where the focus is right now. And we are having conversations, but we are not at this point ready to announce how we are going to open this city up at this point in time. Those announcements or pronouncements will come, but today is not the day for those statements.
So you haven't identified any sectors in particular as of right now?
Today is not the day that I'm going to make those announcements. We have these press conferences every single day. At the right time, we'll make those pronouncements, but today is not the day.
Are you and the county judge on the same page today and moving forward in terms of how you're going to reopen the economy? And I'm asking because some would say that the tone of her news conference this morning was sort of darker and more doom and gloomish than the tone that you have all had here during your news conferences this week.
Well, we're all saying the same thing, and that is this is not the time to be saying to people we're going to open up. In that sense, the county judge and I are on the same page. We both recognize that it's important for people to engage in social distancing, to stay home safely, to work safely, to protect vulnerable populations. We don't want to overcrowd our healthcare delivery system. We are on the same stage, on the same page. There is totally no separation between the county judge and I on that. We are on the same page. But for those people, individuals who want us to start talking about what is the next step in terms of opening up, this is not the time to do that. There will be a time to have those conversations, but today is not the day.
Thank you.
Mayor and Dr. Purse, maybe you guys can answer this, but we talk so much about testing. According to the City of Houston's Health Department, the city only tested 524 yesterday in a facility with a capacity of 1,000. Harris County, frankly, wasn't much better. They tested 700. They have a capacity of 1,200. I know, you know, and those of us on the outside are not familiar with the inner workings of how you get people tested, but it feels like the gap, there's so much need out there, the gap isn't met. Is there a digital divide? I mean, should you go to a system similar to what Sheila Jackson Lee, Congresswoman Jackson Lee has, which is just show up and cut off the car number with the number of tests, something that would be easier for vulnerable communities to get to versus trying to get on the phone or get on the internet, because clearly you have much more capacity.
Well, we doubled, the capacity only doubled as of Monday. And really that announcement was made on Monday. It's really, in fact, it started on Tuesday, and we've been ramping up, just like as of today. I think Butler, is it Butler? Where's Steve? Is it? So Butler, for example, we've already met that capacity for today. So Butler is now diverting people to Del Mar. So we will, Del Mar, okay. Del Mar has already met their capacity, and it is about 315. And so Del Mar is already at the 500 capacity, and they are now diverting people over to Butler. As people become familiar with it, and the calling center now is not just giving out authorization codes to, let's say, 550 or 580. They're giving out authorization codes to a lot more, because we understand even when you give out the codes, there are some people who are not, for whatever reason, not going to be able to make it there. So as you can see today, Del Mar is already maxed out. Those people are being diverted to Butler, and from all indications, they'll probably max out today as well. Dr. First, you want to add anything to that?
Yeah, the mayor's exactly right. And so, Maya, as you point out, there's a lot of moving parts to this. And so each one of them has the opportunity to gum up the works. And so we're learning this, because this has never been done before quite like this. And so we've learned, so yesterday when we talked, I told you that we were going to be calling the people who didn't show up yesterday, and so we've done that today. And we got through a pretty good sample. Between the two sites, you could argue that there were maybe 500 people who didn't show up. We tested 500, about 500 didn't show up. And by about noon today, we had been able to get a hold of 50 of those, which is about 10%, which that's a sizable sample. And we found that the two main reasons that people didn't get tested yesterday was when they got there, the line was long, and they didn't want to wait, and so they left. And then the other reason, I went back to something else we talked about yesterday, when people found out that they had to swab themselves, they didn't want to do that. Remember, yesterday I said that we found that when people were doing it, that they were struggling with that they weren't comfortable with it. So some folks, when they were in line and found out, and so they left. And those are the two big reasons. Then there were a variety of other reasons, but they were very low in number. Those are the two big reasons. So we responded to that with the line, but and we did this yesterday, but we've got all 4 lanes, and both sites are open. And our throughput today has got better because of lessons. You know, these are little fine-tuning things that we learned yesterday. And so we were able to get, and Stephen, I think that you told me that at one site we had about 300 people through by noonish, if I remember correctly, or 1 o'clock. But so the throughput was much better. So there wasn't the line that people were intimidated by yesterday. So again, you know, this is something we're learning every day, and we're improving every day. We're making changes every day to make it faster. So today we probably hit the 500 both sites.
And let me repeat the message again. For the City of Houston testing sites, both at Butler and Del Mar, you don't have to be symptomatic, no symptoms at all. Everyone can be tested who desire to be tested. Simply go to the health department's number, get their authorization code, and go to the Butler or the Del Mar Stadium site. So the process is working itself out, but I feel very comfortable. Confident we'll get to the maximum amount that we're allowed.
And are there any hopes, because I know a lot of people are excited about the Walgreens rapid testing
Yes.
going on in one of the locations in city proper. Where do you see that going? Are you in talks with them to expand that to, you know, there's so many Walgreens, I'm sure.
Right.
People would love it in their
Hopefully there will
neighborhood.
be more. The good news is that, you know, I certainly want to emphasize what's happening with UMC. the 2 Tidwell sites, the one at Cullen Middle School, those are all within the city of Houston. So it's not just the public sites, it's not just the Walgreens, but UMC has been out there for several weeks in testing. And then I do want to acknowledge again what Hyundai is doing, providing the 10,000 test kits, and we'll incorporate that within our inventory. But the testing is not going to come to an end today or tomorrow. It will continue. And so what I want people to know, even if the lines are long, please continue to come, because we do need more and more testing, and we will be ramping it up. And we're all walking through and refining this process as we go along. So it's my hope that more people, more testing sites will come online, more mobile units will be added, and then we'll be able, just like with UMC, to get testing in many of these localized neighborhoods, so that people who may be challenged with transportation, they don't have to go that far. And that's the beauty of like UMC. They're right in those neighborhoods where they have to travel less than a mile or two to get to those sites.
I see the sheriff here. I didn't know if you want to talk about the situation inside the jail, or was there something? Okay.
My questions to Rep. Sheila Lee Jackson. I want you to be able to comment and answer on these issues from Washington, D.C. First is the national harmonization and coordination. I would assume, and others would agree with me, that we may have reached the recovery phase of this pandemic preparedness and response. If we have, why is politics all in this? First question, what is Washington doing? How are you helping the restaurant sector when they are coming here to beg for the community? That's an aspect of their own recovery. But there's a stimulus amount of money, and nobody's talking about it. And maybe nobody's fighting for them. Maybe you are doing that behind the back, because everybody says that all politics is done locally. So we want to get your reflections on that. And the follow-up to that is the issue of opening up, and we keep hearing about this new task force at the national level, the opening task force. It's creating a lot of confusion, because we now have polarization into Republican and Democratic states. In all of this nonsense that is coming from people who are talking and trying to undermine all these other people's job, is not helping us. So what is your take, and why is politics coming into all of this? Thank you.
Let me thank you very much, and let me dispel the issue of politics. You're absolutely right. Just before I came here, I was on a 200-person phone call dealing with not having politics, but working on the very issues that our restaurant association has spoken to. First, let me just acknowledge the local leaders here have been stupendous. They will also acknowledge that funding has come to them, particularly on the testing. Funding will be coming and has come to our hospitals, the first crunch. We have advocated, meaning members of Congress, in a bipartisan manner, that the distribution of the PPP funds are not where we would like them to be. We want to expand to smaller banks. We're working on that. And the Restaurant Association and the size restaurants are all coming under PPP. We want to put in more money for those smaller entities like restaurants to be able to benefit quickly. That's been the problem. Because as you well know, PPP is keep your employees, pay your utilities and your mortgage, and it's forgiven. We are committed to ensuring that we put more money there. But as we do that, we are also committed to understanding the health needs and the needs of hospitals. St. Joseph is here. We're working with COVID patients, UMMC, and others, small hospitals around this community. We are committed for them to have their resources. On recovery, I would say that I take a different slant. I think the 50 governors are speaking to the president, but the 50 governors are led by a Republican from Maryland. They're on the line discussing how they can collaboratively, effectively work on the question of recovery, because it is, in many senses, their decision mayor's decisions, county judges' decisions, and that's how it's going to work. And my argument is that any decision is made on science. It's made on medical professionals. Because I happen to be an optimist. I want my restaurants, and I'm here supporting what the mayor, the initiation of restaurants and takeouts, but I'm also supporting the idea of saving lives. And so I happen to be an optimist. I believe that once we get to the point, and it may be just a window because some are predicting it may come back again, that Americans can be out and about, our restaurants will be restored maybe in a different way, but I want to focus on keeping those restaurants holding on with money we can give them and give their employees the unemployment, the 13 weeks extra, the $600 extra, so they can come back when the scientists, the elected officials who are executives, mayors and county judges and governors work together to decide they can come back. My task right now is to get them how they can stand up for now and as well how they can survive by way of health care, testing, and treatment.
Mayor, Judge Hidalgo's office yesterday received a letter from a group called the Houston Coronavirus Business Group. And that group was arguing that the current restrictions on businesses should not go beyond April 30th. I was just wondering if you have received a similar message from that group or any organized business about reopening the economy by May 1st?
And Jasper, I have not. Look, there were individuals who did not want us to suspend the business of restaurants, bars, and clubs back on March 17th. There were individuals who probably didn't want us to cancel the rodeo on March the 11th. There were individuals who probably didn't want us to cancel conferences and conventions back on March the 5th. And there were individuals who certainly did not want us to issue a stay-home order on March the 24th. But if you look to the Kinder Institute, not my study, but the Kinder Institute from Rice University, they said because those things had been put in place, thousands of lives in Houston had been saved. So I have no regrets about what we have done. And then when you look at the number of people who have lost their lives in Houston, 29 up to today, and look at the thousands of people who have lost their lives in New York City, or the number in New Orleans, or Chicago, or any of those other places, and every life is important. Those numbers for Houston, that number is relatively low. And when you look at the fact that based on what people have done in our region, that our hospital system is still able to handle the caseload within its base capacity, that's a unique story. When you look at the country as a whole, and we happen to be the 4th largest city in the United States of America. So, granted, we are not out of the storm right now, but quite frankly, with the people's support, collaboration, the efforts that have been made, the sacrifices that have been made, where we are, we would not be where we are without their efforts. Now, I think all of us on this stage would love for the city to open up yesterday. But my number one priority as the mayor of this city is protect the health and safety and security of the people in this city. And I know everybody who's laid off probably want to be back to work. But at the same time, this virus is real. And the decisions we have been making, those decisions have been based on saving people's lives. And just as soon as we can reopen our city, we will do so, but we will do so with the health and safety of our people in mind. That's the best answer I could give to them.
It sounds like
Dr. Person, Dr. Person, to chime in.
Yeah, an important concept I think people need to understand is that as we move towards reopening society, and that's not my decision, that's going to be others' decision, but from a public health standpoint, and what it is my decision, and what it is my area of expertise, is that you need to understand that we, as society moves forward, we need to get back to a situation where we have sufficient testing so we have a good idea of what the virus is doing in our community. Because ideally, we will get to a point where when somebody contracts the virus, we will know that quickly, be able to then do the contact tracing and stop the virus. If you remember when it first came to Houston with the folks that were on the Egyptian River cruise, that's what we were doing, and we were able to effectively stop the virus from that river cruise. It then, mysteriously, we still don't know how the gentleman who was working at the barbecue cook-off got infected. Somebody infected him. And by the way, he just got out of the hospital yesterday. All right, he's been sick this entire time. All right, so as we move forward, one of the things that, from my opinion, from my area of expertise, that has to happen is we have got to have sufficient testing in the community. So that's why the federal government, and I need to thank Congresswoman Sheila Jackson-Lee for all of her work to get the federal government to get not only the number of tests that we have available, but also out until May 30th. And then in addition, the gift today from Hyundai and our partners at UMMC, and we have other partners in the community that are testing, like Legacy Clinic, for example. So we need to get way more testing in place so that we will have the ability to know what the virus is doing so that we can control, to the best of our ability, the virus, while at the same time getting society back on board. Because if you just turn it back on now, all you've done is delayed the spike. So it's a kind of a complicated concept, but the efforts of our colleagues and our friends are vitally important to moving forward.
It sounds like there's also a little bit of a push to put together some sort of coronavirus recovery council. You may have seen Angela Blanchard put together some op-ed about that recently. Do you see the need for some sort of recovery council, and if so, who would be the stakeholders involved?
Well, the county judge and I have had several conversations, and very shortly, just like we did with Hurricane Harvey, I will be announcing you can say, a recovery czar representing the city, and she will be announcing someone representing the county, and they will serve as co-chairs, and I anticipate that taking place in the next few days, if not sooner. And then let me just say, since I've been mayor now for, let's say, 5 years, and I've gone through several storms, and Hurricane Harvey being one. And during the storm, we were telling people, stay off the road, stay off the road, stay off the road. And there were some people who were, in spite of that warning, they got on the road. And they end up putting the lives of our first responders in jeopardy. Because when they found themselves on the road in trouble, who did they call? They called our firefighters, our police officers, and they jeopardized them. This is still, it's not a hurricane, but it is a storm of a different kind. It is one thing to make decisions when you are healthy and you don't know whether or not you have the virus, but you feel healthy, you think everything is fine, and so you're making decisions based on your status. But when you make decisions and then you find yourself sick and you start calling first responders, then you jeopardize their lives and the lives of others around you. Just because you are well, or it appears as though you are well, doesn't necessarily mean you should make decisions for the rest of society when we are fighting an unseeable enemy. And unlike a hurricane that you can see on the radar screen, you cannot find this particular virus on the radar screen. It is the hidden enemy. And this hidden enemy literally can be in your home or standing next to you or in your church or someplace else. And that's what we are fighting against in this situation. And what that means is that the strategies to fight this virus will be different from the strategies in dealing with a hurricane. Because when the storm clears, when a hurricane clears and it's no longer on the radar screen, you can come back, you can come out. But you cannot look on the radar screen and find this virus, and the only way you really can find it is by testing. And that's why we test. And that's why I'm delighted with what the Congresswoman and Hyundai have done, providing the 10,000 test kits. And people, and we're saying, whether you are symptomatic or asymptomatic, go and get a test. Because that will help us to find it. Contact tracing will help us to find it. And then when we know where it is, at least on a significant level, then we can start saying, okay, fine. In the meantime, that's the reason why we're saying to people, put on your face covering. Because you can look healthy, but that doesn't mean you're not carrying it. So put on your face coverings. Now, someone asked me about the plan to move forward. I can tell you, social distancing will probably be a part of the regimen for quite some time. Wearing your mask or face covering will probably be a part of your regimen for quite some time. Working remotely from home will probably be a part of your regimen for quite some time, okay? And we will enter into open things up, not all at one time, but it will be in phases.
Mayor, I want a clarification on this question. The Attorney General has given an order and is defending churches in Louisiana, Alabama, and other places based on their criticism of discrimination. So I want you to be very clear, because from day one, when we started all of this, immediately after your installation, I never heard you say that there's an order, or the Congress, the State House, or the governor has passed an order that people should not go to church. You kept saying that people should cooperate, people should make sure that they help others. So what do you have to say to what Attorney General Barr is saying, defending churches now and people who are saying that they have the right, like the other essential services, to be out there? Did you make an order to say churches shouldn't come together, or you were just asking them to be able to cooperate somehow? Let's get these things cleared up.
Well, there are some things that just you clear up as much as you can. I certainly respect freedom of religion, and people have certain freedoms. We ask people to abide by social distancing and to worship online. And I will say to you that the overwhelming percentage of worship of faiths have done just that. And so instead of me criticizing people, let me thank them. Let me thank the faith-based community for being very, very supportive. Let me thank the faith-based community for your prayers. We had a moment of prayer last Thursday at noon. Prayer works. So I'm not here to get in a battle with anybody in the faith-based community. I consider myself a person of faith. And I think people are very responsible, and they want to do the right thing. And let me just answer your question by saying, I pray people will do the right thing.
Mayor,
Yes,
I
sir.
have a question from the Chronicle. Some labor leaders were in City Hall this morning to call for COVID-19 rent relief, like Austin has provided, in form of 60-day grace periods for renters who fall behind and on capped late fees. Are you considering those measures?
Well, the Texas Supreme Court has said there can be no evictions through April the 30th. I applaud the Texas Supreme Court for that, and I hope that the Texas Supreme Court will extend that through the month of May. I hope there will not be any evictions through the month of May. I want to applaud those apartment owners like Camden Properties, and we had Swamnil Agarwal, who was here. They are both major apartment owners. They are not evicting anyone in the city of Houston. In fact, they have set up funds to provide cash payments to those tenants who have lost their jobs or lost their income. I want to thank them for that. I read a letter from the Houston Apartment Association that indicated that 90% of the tenants in the month of April were able to either reach an agreement or pay their rent in the month of April. They did say May was going to be a very sensitive month. It's my request, and one of the things I will be saying to, for example, to our congressional leaders in a little bit, is the dollars that have already been awarded to cities like the city of Houston allow us to take some of those dollars to do two things. One, to fill in the revenue gap for municipalities caused by COVID-19, and the other to give us the flexibility where we can enter into certain rent relief programs with some of those dollars. The difference between COVID-19 and Hurricane Harvey, damaged buildings, brick and mortar. COVID-19 didn't do the damage to the buildings, but it damaged people. It put them in very vulnerable conditions. So if we have I'm simply asking not for any additional dollars for cities like the city of Houston, but just give us the flexibility to fashion programs and strategies that will assist tenants, renters, employees, small businesses, to assist them in getting back on their feet. If we can get that sort of assistance from Congress, then we can meet the needs of so many people within our city.
From KTRK, Travis and now Dallas counties are requiring face masks in public. Are you and Judge Lina Hidalgo considering the same step for Houston?
Well, in every one of these press conferences, I've encouraged people to put on their masks. And the task force that we put together, being led by Shannon Buggs, Director of Complete Communities, that's one of the things that we're focusing on, two things for vulnerable communities: education and the resources that they need in order to protect themselves from others in these communities. But the masks and things are critically important. And it could be a bandana, just like Mayor Pro Tem is wearing. It could be a mask. I've had masks made by grandmothers. So we're strongly encouraging that. One thing that I've discovered with mandates, when you're mandating something for vulnerable populations and people who may not have the resources or the means, you need to also make things available. So when you get to the point where you start mandating, you also should have a plentiful supply in order to provide to individuals, communities who are most vulnerable, in order to be able to meet those particular mandates. I strongly, strongly, strongly encourage people to wear face coverings. I'm not saying we won't get to that point, but as of today, it is a very strong recommendation for everyone, especially when you're around individuals, or even when you're at home where there are other individuals, to put on face coverings.
Yeah, and last one. I know you touched a lot on the reopening of the economy, but they want to know if, for these decisions, have you been in touch with Governor Abbott about this reopening the economy?
Well, Governor Abbott is going to be making a pronouncement on tomorrow, I believe, and so we are all waiting to see what those pronouncements will be. I think we're all listening to several, looking at the data, listening to our medical professionals and the advisors on that end. There are a number of indices that you look at to make that determination. I just want to put this cautionary note. While you're still going through the storm, you have to be very careful when you start focusing too much on the other end, while you're still going through the storm. So let's not act like we're out of the storm and everything is fine, because we're not. We're not out of the storm. So patience is a virtue. I know we've asked people to make huge sacrifices, but we're having those discussions. People are talking about it. I know the president is talking about it today. I know the governor will be talking about it tomorrow publicly. Others are having those conversations. The county judge and I are in the process of naming a recovery, for lack of a better term, czar, one for the city, one for the county, that will be serving as co-chairs. So we're all having those conversations. But for today, let's focus on doing everything we can to mitigate the impact of this virus, to slow the progression, so that our healthcare delivery system will not be overwhelmed. The last comment by Congressman.
With respect to housing, we are now in deliberation, Mayor, to assist in the HUD housing, is what I believe they were asking. And that is that we realize that some housing are investment properties for some. That means they depend on their income on that. And then we know that persons who are in the housing are themselves suffering. So we're looking to provide resources, maybe through the city's request, through CDBG funds, to be able to help what we call those non-HUD properties, because past the April 30th state order, we know that there will be people who will still be in dire conditions dealing with, if you will, the question of housing. And those who are in particular plight are seniors who are living on fixed income, and because of food insecurity, we realize that they will be in challenging circumstances. We are finding out, Mayor, that seniors who are on SNAP, for example, are not able to order online or get delivery at the curbside, and we have many things that have to be addressed. So I would just say that we're going to listen to the mayor, the county judge, and we're going to put forward a CARES 2 package that really focuses on services, helps you in recovery in terms of businesses, and realizes that, as has been said, and what I believe in, that this journey is going to have mountains and valleys. Anybody that thinks that we are there, we still have some mountains and valleys to go through. It is dangerous not to recognize that you have those. I have Mr. Brooks on the phone, and he just wants to say thank you to you, and sorry that the technology did not allow him to be able to say thank you, but I just wanted to say thank you all so very much. Mayor, I do want to end by thanking your first responders. They've been stupendous on the testing site, police. We thank the fire department, medical professionals. Thank you very much.
Thank you. We are the best responders, first responders, and employees in the whole wide world, and so I certainly recognize that, and appreciate each and every one of them. So thank you all so very much. Thank you, and we'll meet again, I'm sure. Thanks.